You should embrace your curiosity and let it get the best of you. That's what I'm here to talk to you about today. I'm going to specifically focus on the doctor-patient relationship and explain how doctors should embrace their curiosity about their patients because it helps them do their jobs better. And at the end, I'm going to tie this back to you and explain how it's relevant to your everyday life. But first, a story. When I was 11 years old, I, unlike anyone else in middle school, started to experience some changes in my body. And the thing that I hated most was that I started to grow hair on my legs. So one day, I took matters into my own hands. I hopped in the shower. I started lathering up my legs with a bit of Neutrogena soap. I reached for my sister's Venus razor blade, and I started landscaping the back of my calf when I started to bleed. It was at this precise moment where I thought I was going to die. I'm not kidding. I really thought I was going to die. And now this fear that you develop when you get injured or your body doesn't feel right or it's not working properly, this is a totally human emotion. And this fear is actually the absence of curiosity because we get paralyzed by that fear. We don't want to know what's actually causing our suffering. So the problem is that most doctors, as they go forward in their careers, they get disconnected from this human emotion. And the issue is that the way we learn information in medical school isn't really congruent with the set of skills you need to be a good doctor. Now, I'm a medical student. I've done my fair share of library hours studying biochemistry, immunology, pathology. I've done the rotations through the major specialties. But one moment in particular during hospital rounds at the VA sticks out to me. So our clerkship director came up to us during rounds, and she brought this large rectangular object. It's something most med students had never seen before. It's called a novel, some sort of storybook. And she explained to us that storytelling has a therapeutic component with patients. And she clarified that by saying, don't go in there and tell the patient your story. You should go in and ask them, tell me your story. So we tried it out. We had to try it out. It was a requirement. So the next hospital I was at, I went into a patient's room, and she had a stroke, which is like a pretty treatable condition. But on some incidental tests, we found out that she had advanced stage cancer. Now, when she learned about this diagnosis, I could sense that she was not really digesting any of the medical information that was coming her way. So I paused during my rounds with her, and I said, tell me your story. So I learned from her that she is a community activist in her community in Southwest DC. She loves cooking pies. She would leave her kitchen door open so that anyone coming by could come in for a piece of pie. She told me her family and friends call her Sugar Mama, and she insisted that I call her that too. So understanding this about Sugar Mama allowed me to connect with her in a way that none of her other doctors did. She needed human connection. She needed someone to listen to her, to feel her pain. Sometimes she needed someone to just shut up and sit there and hold her hand. Now, Sugar Mama always turned to me among her providers to explain her treatments, tell her what's going on with her diagnosis. And then 3 months after I worked with Sugar Mama, I attended a celebration of her life. So what's the story here? Patients appreciate when they feel like they're being treated like human beings. They can sense when they're being dealt with as items on a checklist, and they don't like that. Story listening is such an important tool for the curious. Allowing someone to open up to you on their own terms is such a profound way to establish a human connection. So this story listening thing might work for med students who have really abundant time, only a few patients to take care of. But the reality is it probably doesn't work for most doctors. Now, as I was going through my med school rotations, I became attuned to this reality, that doctors are burdened by a lot of these things up here. Now, they're important for patient care, but they actually detract from the amount of time you spend with patients. So as I kept going, I kept wanting to do this story listening activity where I was making those connections similar to what I've made with Sugar Mama with my new patients I was working with. So I looked within my own field, my future specialty, for an example. Now, ER doctors have a crazy job. They're basically supposed to make sure the patient isn't dying. If they have to stay in the hospital, get them to the right floor of the hospital. If they got to go, get them out on the right treatment, right meds, and make sure they know who to follow up with. Now, when I heard about what one ER doctor in Boston is doing and how she's helping her patients, I was particularly impressed. Hani is the co-founder of Heal Trafficking, an organization devoted to identifying victims of human trafficking in the ER. Now, how amazing is that? I was so impressed that she was able to call attention to an issue that's under-recognized by society and make her colleagues pay attention to it. So I asked her, Hani, how do you do this? How do you advocate for something outside of your clinical duties while working within the pressures of the ER? And she told me it's simple. Be present and show that you actually care. Be present and show that you actually care, and the patient will open up to you about issues that matter to them most. As she said this, I realized it's not just her issue that she's talking about, human trafficking, but having this mindset of presence that allows the patient to open up to you about any issue that matters for their health. This shows us that curiosity with a purpose allows you to do things beyond the call of duty. Now, if it can work in the ER, it can work in any part of the hospital or any doctor's office. So what am I advocating for today? Not sort of any major overhaul or revamp of medical education or training. We all need a reminder from time to time to be present. So what do I do? Before I enter a patient's room, I close my eyes and take a deep breath and do a mini meditation. I remind myself about three things. 1, this patient is a person. 2, this person does not want to be in the hospital. I seriously have to remind myself about this because I love being in a hospital, and I have to be like, this person doesn't want to be here. And 3, I'm in a position to help this person. That's it. It's simple. Doing this mini meditation each time allows me to reset my brain so I can be present with that patient, so that I can be present for that person I'm about to work with. Now, this might work for other doctors. This might even work for you. Where does that leave us today? If drawing out stories isn't your thing, just be. You don't have to be a doctor. You don't have to be a martyr to help someone in need, nor will you be able to deliver the best help by simply asking someone, what can I do for you today? Even if you're in a field where you don't work directly with people, you have people in your life who depend on you. Selfless curiosity is taking yourself out of your perspective in order to allow someone to open up to you and establish that human connection. And that's when you can begin to make real progress. Thank you.